Hello, everyone. Thank you for joining us today as Asian Columbia Alumni Association launches its campaign to bring together fellow Asian Columbia alumni around the world in our fight against COVID-19. United, we have accomplished so much, as you will hear today, and we will continue to accomplish even more. Now, more than ever, we need to raise our voices, share our stories, and support each other during this difficult time. We want to hear from you about the unsung heroes in our midst who are leading and inspiring others. We want to hear from you to let you know that ACAA is a community that will support you in whatever way we can. Let's share and heal together. My name is Ying Yan, and I am the Vice President of ACAA. I will also be the moderator for today's webinar. Before I introduce our panelists, I want to inform you that this webinar is being recorded and all attendees are muted. We will have a Q&A session at the end. If you have a question, please type your question in the Q&A box anytime during this webinar. I will select a few questions to ask the panelists during the Q&A session. And now I am excited to talk about an amazing project that connected Columbia alumni from China and the US in the pursuit of getting much needed personal protective equipment, or PPE, to doctors and other healthcare professionals on the front lines. For over a month in March and April, the Columbia Alumni Associations in Greater China united fellow Colombians across Asia and New York to raise over $2.1 million in cash and in-kind donations from over 300 donors. It was a huge logistical exercise that involved more than 100 people in the procurement of PPE in China, coordination with logistics companies, and the distribution of the PPE by alumni doctors to hospitals in New York, New Jersey, and Massachusetts. The PPE included more than 3 million surgical masks, 21,595 masks, 61,000 face shields, and other much needed equipment. Deliveries were made also to the New York City Fire Department, Police Department, and to Columbia administrators, staff, and students on campus. This effort exemplifies the Columbia spirit and the power of the alumni network. With us today are some of the people behind this initiative. We have Dr. Ernest Chu, a 1994 graduate of Vagelos College of Physicians and Surgeons. Mary Kuo, CAA board member, President Emeritus CAA Club of Singapore, a 1992 graduate of Columbia College and proud parent of 3 Colombians at Columbia College. Dr. Thomas Lowe, the Vagelos College of Physicians and Surgeon Alumni President, a graduate of VPNS in 08. Nina Sun, Barnard Trustee, a 2001 graduate of SIPA and parent of a 2014 Columbia College graduate. Dr. Jun Wu, a 1996 graduate of VPNS. And then we have Rui-Fen Xu, board member of CAA Shanghai Club of Columbia, an 04 graduate of SEAS and an 07 graduate of GSAP. Last but not least, we have Nick Yen, President Emeritus CAA Singapore Club, a 91 and 92 SEAS graduate. Thank you all for joining us today, panelists. We're just going to jump right into it. I thought it would be a good start to have an overview of the project and how you all got connected to each other. Rui-Fen, you were involved in this project quite early on. Would you tell us a little bit about this project? Okay. Please unmute yourself.
Hi, Ying. Thank you. Can you hear me?
Yes.
Yeah, thanks. Yeah, we started in Wuhan in January 25th, who needed help for PPE delivery. We made a delivery to several Wuhan hospitals. So on March 23rd, Nina Sun, along with Roy Vagelos, the first initiate 2 trustees, reached us for the PPE to New York because we already have the resources, knowledge, logistics when we helped Wuhan. So we understand the urgency, so we could act very fast. Within 2 days, we made the first shipment to New York on January 25th. So after we made the first shipment successfully, so then the broader CAA, CBS, 17 clubs all joined us together for the fundraising. On April 2nd, we made the official announcement to 17 clubs for the broader fundraising. We needed to ship more suits and a face shield. Singapore team, Mary and Nick offered the help for the fundraising and the distribution to the hospitals and doctors. Once the doctors get involved, Thomas, Ernie, and June, 3 doctors, then and later more doctors, then we understand the actual needs from the hospital. So that's why we started. Hello?
Yes, wonderful. Thank you. That's a great summary. I think this is a good time to really delve in deeper to ask this panelists how they got involved specifically, and after learning about this initiative, what motivated you as panelists to get involved, and then how did you get involved? Let's start with Nina, please.
Yes. Hi everyone. Okay, let me start. At the beginning, when I be quarantined at home and watch news every day, I learned that New York hospital short of those PPEs. So I wrote to Roy Vedras. He is the chairman of the board at the Columbia Medical School, and I said, I would like to give some help if, Columbia Medical Center need any PPE. So he forwarded my email to Dean Lee Goldman, and then Lee Goldman forwarded my letter to the vice president of the CUMC, Donna Lin, and Donna forwarded my email to Michael and her staff, and Michael forwarded my email to Matt. So actually on this email, I don't know, I never met Donna and Michael and the Matt, but from the emails, I realized it's urgent and they have huge shortage. So I was going to just collect some PPEs from the students in New York City. So that's be quickly in the second day we can deliver to hospital. But from the emails, I realized it's huge amount, shortage. So I posted the, message on my WeChat, the friend circle. I have maybe more than 3 friends. Some are Columbia alumni, parents, and students. I said, that possible, anyone could help us, could help Columbia. And in the same time, I organized a small, volunteer group of the students in Columbia to prepare for receiving these things, because the email in circle inside the Columbia Medical School were very slow. I think it's the first time everyone had no experience and be attacked by this huge pandemic and had busy on their own duties. So I tried my best to do anything we could prepare to do from China's side. And from the WeChat, one of the alumni told me, Raven has experience, why don't you connect to her? And she might have the Shanghai Alumni Association could help you. I said, that's a wonderful idea, because I was the chairman of the Shanghai Columbia Club Association for about 10 years. I met Raven before, so I contacted Raven and I find she really great, on that, and she has a lot of experience on purchasing, on shipping, on fundraising. So, and then I changed my role. Instead of organize the whole things, only focus on, raise the money and PPE from my friends and some parents I know, and also help the students here at Columbia students, especially the CPA students who are still living in dorm, and organize them to prepare for receiving. Then I also back to the Columbia Medical School. And on that side, I try to help them to understand our goodwill and our Columbia alum, the family, and let them trust us, because most of people at Columbia CUMC and never met me and never met our students and the donors before. And for them, this is new things. So that's what I did help on this project.
Thank you, Nina. Thank you for really jump-starting this. Maybe it's a great segue to Ray Finn. Ray Finn, could you share your involvement, please?
Oh, yeah. Hi. Thanks, Nina. You know, my role is mainly to work with Nina for the fundraising, for the PPE sourcing and shipping from Shanghai to New York.
Oh, I think we have some technical difficulty. When Rayfin can join us, we will have her share her story. At this point, let's move on to Ernest. Please unmute, Ernest.
Hello?
Oh, I think we have Rayfin back.
Yeah, I'm back. Sorry, I lost it. Yeah.
Ernest
Yeah,
will
so get
go back to
a
Rayfin.
waiver agreement signed for the major donor from NYPD and Mount Sinai, and work with Mary to deliver the PPE to the hospitals through doctors. You know, I like to show some pictures. And during this time, Nina really gave me a lot of help and guidelines, you know, for these requirements from different hospitals. I would like to show some pictures. Could we share the pictures? Okay. Mary, do we have the pictures?
Yes, it's on the screen right now.
Oh, okay, sorry. Oh. Yeah, these are the first shipment we made from Shanghai to New York. So for our shipping process is continuously evolving. These are our alarm shipped from the personal shipping from DHL office to New York. And these are the receiving packages and some small packages. Our first delivery to Brown Medical Care Center. The next slides. So next we have more big boxes shipping, which is still personal shipping from Shanghai to New York for the suits and for the face shield. So the NYPD doctors wearing their face shield with the Chinese character, and the Brown Care Center to wear their suits with the blue tape, which is the best suits. And our student coordinator to help with the shipping. And the next slides. We have the 15,000 N95 we ship to NYPD and Mount Sinai. And so these are, we are able to source from the larger vendor, so they could help us to deliver to the hospital directly. And we also deliver 150,000 medical masks to NYPD, FDNY, CUMC, Columbia, and another 5,000 isolation gown.
Okay. We have some technical Rayfin is actually in Asia now, so there may be a bit of a lag.
Yeah, so okay, I'm back again. Yeah, on the way to NYPD. So the last we have the youngest alum, which is Catherine Liu. She reached me to donate 350 N95 to CUMC. So she is 2021 Cs. Thank you. So these are some of the, you know, experience we have.
Thank you, Rayfin. Okay, let's move on to Ernest. Can you please share your involvement and what motivated you to get involved? Oh, Ernest, just there you go. We can hear you now.
Can you see my first slide?
We see a slide, yes.
Okay, good morning. My involvement came serendipitously. The person circled here, his name is Mark Clemente. Mark was a Columbia alumni in 2008. He was the first position player for the Columbia men's tennis team and helped the Columbia team win multiple Ivies. He taught my son here how to play tennis. Last year, he reached out to me and says, oh, there's an interesting person named Mary Kuo. And he said, you probably should meet this person. She comes frequently. She's a jet setter and she comes frequently. And I said, well, my criteria to meeting someone is that I like to have a scalpel in my hand. The other thing I enjoy is having a drink or chopsticks or knives and forks. So we started a communication over several months in 2020. She came here and we had several nice meals. Then in March 29th, 2020, she reached out to me, does your hospital need masks? And I'm also looking for some doctors at Flushing Hospital to maybe help deliver that. And I said, well, that's interesting. I will do my best. I have a couple friends in town that may be interested. So I'll backtrack a little bit because January 25th, 2020, we were invited to a Columbia dinner. It was really Lee Goldman's farewell dinner, at least in my position. And we had an opportunity to sit there and celebrate with Jun Woo here and David Chu, who is a Columbia graduate and former chief of plastic surgery. But the most important person at that table was this gentleman, Thomas Lowe. And I didn't know who he was, but he was sitting at the most important table, and he's actually the Columbia alumnus. And June and Thomas have much deeper Rolodex than I have. So I said, the main thing is we enjoy eating. Tom is a good cook, a great cook. He runs a very nice restaurant. And I said, I'm going to recruit these guys. And so they joined in their way to help out in much, much deeper things than I could offer. We know in April 3rd, 2020, this is a graphics from the New York Times. We know that New York City and the region is most impacted. There are lots of deaths in that area. But if we dive deeper, we can see here the 5 boroughs of New York. And if you look at it more carefully, you can see Manhattan, where we are, is relatively light in color. Columbia is up here on the Upper West Side. Columbia Presbyterian's up here, Cornell's here, NYU's here. But the big epicenters were in the Bronx, Elmhurst, where we were looking for people, and then in Brooklyn. This here is another interesting slide because I think this shows you where the COVID concentrations are located most by zip code. You can see Manhattan tends to be lighter in color. I do know a lot of people have left the city because they're fortunate, they have other resources, but there are other places that are very dense in darker colors where these are the really areas that focus significantly with having problems. And if you look on the one to the other one, you can see a lot about that. So a couple days later after this initiative, some boxes arrived on in my thing, and it had this thing says, with thee is the fountain of life. And I really was like, wow, this is someone really did a lot of effort to get here. So my role was to help to deliver some of these to my hospital. And I had several wonderful people who assisted me. And these are the boxes that were sent. Thank you.
Thank you, Ernest. And now let's move on to Thomas. And I'm going to spotlight Thomas.
Hi, thank you so much, everyone, for joining us. Ernie, that was a phenomenal presentation of kind of how things evolved. So like Ernie said, really it was that's exactly what happened. I got a WhatsApp chat from Ernie, who, as he mentioned, I had recently met in the last several months, actually through the Medical School Alumni Association. I was the president. I hosted several events. I actually had known June Wu, actually back when I was a medical student, and she was actually one of, and still is one of the plastic surgeons at Columbia. And June and Ernie were friends. I met Ernie. We hosted a really nice banquet at my restaurant. So before I was a doctor, I went to cooking school. I was a chef also. And that's how I got to know Ernie. And right when this initiative started, Ernie just sent me out a WhatsApp link saying like, hey, how's it going? You should meet this woman named Mary. Do you know her? I'm like, no, I never met Mary. And that's how it started. Mary Kuo, we started chatting, and basically it was a simple question. Hey, how are you guys doing in New York with PPE? We're trying to start this initiative with the Columbia alumni in China. And we want to, send you guys PPE, and we need to know which hospitals are in need. And we also need to know, we also need addresses of doctors that we can send them to. I said, all right, cool. That's, so I'm an anesthesiologist, and, I work in the front lines. I intubate these patients, and I've been in touch with a lot of my medical colleagues, and we heard the same stories. A lot of very sad, devastating stories of people getting sick, people dying, also healthcare workers who didn't have the necessary PPE. So, I was very inspired, and Mary was wonderful. And over the course of the next 3-4 weeks, Mary and I communicated probably, I would say every day for probably an hour plus. What I did was, as the president of the VPNS Alumni Association, the next day I sent out an email to all the alumni and simply said, hey guys, how are you guys doing on the fight against COVID? Hope you're well. What's your PPE situation? And within, I'd say 10 minutes, and within the next day, I just got countless emails of alumni who worked in New York, and actually all throughout different parts of the country, saying, this is my situation, we're in desperate need of PPE, please help. I spent the next several days calling them, talking to these alumni over the phone, and getting their addresses, understanding their needs. And Mary and I put together this huge database of their addresses, phone numbers, what they need. And within, I would say, a week, we had PPE boxes delivered at their doorsteps. And at that point, they were able to bring them to their respective facilities. So that was my involvement. And, I have, Ernie to thank for introducing Mary, and Rafin, who I also worked with on many WeChat text links, and also June, who helped deliver a lot of the actual PPE to the hospital. So thank you.
Thank you, Thomas. All right, and that's a great segue to June. Let me unmute you.
Hi, good morning, everyone, or good evening if you're in Asia. I got involved in this whole situation actually through Ernie. Very much like Tom, one morning I woke up to a whole slew of WhatsApp messages talking about this effort, and there was this name, Mary Kuo, and then that's how I really met her, through this WhatsApp situation, and we were talking about how we can help. And I'm going to give a shout out to, Tom and Ernie, because they have been on the front line taking care of COVID patients, unlike me, because I'm a pediatric plastic surgeon, and the hospital specifically said that we weren't particularly needed. So I have not been on the front line myself. And so, but meanwhile, my own cases were completely canceled, and I found myself with, more free time. And so I said, well, how can I help? And, in addition to lending, my own address, I have a car in the city, which now becomes a very, useful commodity, because then I was able to go and collect a lot of these boxes from individual addresses and then get them delivered to the hospital. And so, it was in the beginning when there were some questions about politically, would the United States, accept these PPEs or would China let them out? And so that's why we were, sending them to the different alumni who were based in New York. So we want to give a shout out to them as well. And so my involvement really was more the actual distribution and the physical lifting of the boxes to where they were. And I got to see some of the surgery residents, to whom I gave them, to whom I gave the boxes, and they were very, very appreciative, and they were so happy to see my face. Really, probably they were more happy to see the supplies, but that was good.
Great. Thank you, June. You were really, I guess, what they call the last mile to get the PPE into the hands of the doctors. So, and let's move on to Nick. I'm going to spotlight you. Go ahead.
Oh, hi, everyone. Thanks for joining the call. So for me, this whole process started sometime in late March. I was talking to some of my friends who were doctors, alumni based in New York, and they were telling me how dire the situation was. And obviously you read and hear about all these news coming out from New York, and it's really, really depressing. So this is sometime, like I said, in late March. And so Rayfin actually sent out this group chat on WeChat asking for, I guess, donations to buy PPE. And so it got me thinking about how maybe I'll be able to make an impact. So I reached out to Novi and Mary Kuo because I'm not very good at giving away my own money. So I thought maybe I'll reach out to other people to give away the money. So we started the process. We actually started looking at PPE, even in Singapore, but we then realized that I guess it was easier to just work with Rayfin to ship the stuff up from China, because a lot of the suppliers in Singapore actually were shipping up from China anyway. So we actually got together and started to raise funds, and we actually did that in 2 days. Mary started reaching out to everyone else in New York that she knew, and she was doing a lot of the work that I was just trying to help with some of the other stuff. But it was great to be a part of this. I'm so happy for the doctors in New York, and especially I think some of the friends that we have in New York. These are all alumni, doctors on the front lines, and I think this has been an amazing effort from everyone, especially Tom, June, and Ernest, and I think some of the other volunteers in New York as well.
Great, great. Thank you, Nick. The next question I have is one for all the panelists as well. It sounds like we all had our lives turned upside down as a result of COVID-19, and you still found the time to get involved. I'm sure there were many, many challenges. So I'd like to hear from all of you briefly, what challenges, if any, you came across. And let's start with Nick. We'll come back to you, Nick.
Yeah, so as Tom mentioned, I think initially, and again, this is way back in March, the situation is just getting really bad in New York. And I think, so we reached out to Columbia Medical School. And then we were getting different information from different places and different people. So that was how, in the end, we started reaching out, in fact, to Tom and some of the other doctors, because we thought maybe they would be able to give us the best information since they're all on the front lines. And so Mary and I and Rayfin, we decided to talk to them to see which are the items that they really required the most. And we then focus on those items. And the other challenge that we had also was the fact that I guess a lot of the PPE coming up from China were fake. And we came across actually quite a number of them. So we had to go through pretty much a crash course on PPE. We became really familiar with like acronyms like 3M, FDA, CDC in the US, and MPA in China. And we also got really, I guess, familiar with the whole process of exporting all these items and how maybe the FDA was controlling N95, KN95, and I guess some of the European certification certified masks like FFP2 masks. So we became really experts at the whole process of verifying the authenticity of these masks and PPE, and then the whole export process. I was telling Rifin that we could probably moonlight as PPE brokers, if we want to continue doing this. And I think he's probably too tired to do this anymore, but we could probably even do it.
Great, great. Thanks for sharing that. Let's move to Nina. Nina, did you experience some challenges at the beginning of this project?
Yes, yes, of course, there's a lot of challenges because this is the first time we do such a project across the ocean continental from Asia to New York. And also this first is a time difference. I didn't sleep almost in the first 2 weeks, every day, only 2 hours. Because in the night, I have to communicate with donors. The donors they donate like 10, 20, 50, N95 masks to the donor who are willing to give like the $250,000. And each of them, you still need to spend almost the same amount of time to explain to them, to appreciate them, to help them, to communicate with different part of our whole, the supply chain, like, from, signed liability waiver letters to, delivery to, receiver. It's a lot of work and it takes a lot of time. And back to the daytime here, we have to communicate with New York side, talk to Columbia side. And secondly is, most of people we never met before, and until now I haven't meet them yet. So it's need to be trust each other, and it's a lot of the missed information in betweens and try to fill in and make quick decision, because always like Rayfon asked me, if I have this certain amount of the merchandise PPEs, do you need it, where we signed, and the other side, the Columbia Medical School and hospital, they are busy and they don't answer me anything. So I have to make decision to say yes or no without enough information. And the other is we need a lot of students here to help to receive those PPEs, the small packages, and their dorm are small. And some of the parents, back to China, they worry too much from the news. They learn about the New York has the high peak, and they don't let their children to involve anything outside of their dorm and tell them don't touch anything, don't do anything. Of course, they are young students and they feel frustrated to either follow parents' order or to do something, help, our organization, help Columbia. And the other is, the very important is the trust each other, and in such quick time. Yeah, that's all.
Great, thank you, Nina. We're gonna move to Ernest. You share some challenges you might have come across?
My biggest challenge that I encountered was trying to figure out the logistics of getting the supplies to our hospital. And every hospital is a little bit different. At NYU, I asked my chair to help me make that decision, and he says, just take care of it. So I made some phone calls. We had the paperwork signed, and then we just got it to the supply chain office. The supply chain then decides where the greatest needs are. For example, the Frontlines is usually the emergency room, the anesthesiologist, the ICU setting. We were fortunate in that it went pretty smoothly. I tried to help out to other hospitals, which is the public city hospitals, and they had their own rules. So each hospital is different. Thank you.
Thank you. Mary, let's turn to you. Any challenges? I'm sure you had many. Love to hear one or two. Please unmute yourself.
Oh, okay, thank you. Okay, yes, there were mainly, as the doctors mentioned, I was mainly involved with the distribution of the PPE in New York City and getting the PPE from the students' homes and people's homes to hospitals in a timely manner. I just wanted to share some photos with you regarding the process. Here we have the student volunteers. They helped, as Nina mentioned, they helped store the initial round of packages that arrived in New York City. We have a student volunteer, Nee, on the left, and student volunteer, Roy Howe, on the right. And just to give you an idea of the type of boxes that were being stored, you can see all these boxes which are in the hallways of the dorms that needed transport. So it was quite a challenge to get the PPE into the right hands. So it was really a grassroots distribution effort, and it was not easy to get drivers, volunteer drivers, mainly because not many people in New York City have cars, and many people weren't very comfortable to leave their homes, let alone pick up packages and potentially expose themselves to the virus. And plus, the last place people wanted to be near was a hospital. And the job was also not for the faint-hearted, because one of our volunteers, during their first drop-off to Elmhurst Hospital, they had walked past many refrigerated containers with corpses inside. So in the end, thankfully, it all worked out, as the doctors themselves, including the three on this panel today, spent time driving around Manhattan picking up packages. So you see there's Thomas, and then there's Ernie and June, who stepped up to the plate essentially to help bring a lot of packages from the students' homes and people's addresses to the hospitals.
Okay, thank you, Mary. Thomas, I'm going to ask you if you had any challenges that you would like to highlight. I know there are many.
So many different challenges that, so for example, you know, this is a huge logistics puzzle that we needed to solve within days, weeks. And what's interesting is initially I thought my understanding of the project was, okay, you need a bunch of addresses of doctors. Sure, let me send out an email. Let me type up, you know, for the addresses, the docs information, we're all good. And very quickly, I realized, well, that's just one little aspect. Like Mary said, there, and Ernie too, there's a lot of little puzzles that needed to be solved. Getting liability waivers signed from each hospital so that, you know, that the CAA is not liable. And every hospital has its different policies. Some hospitals wanted their own liability waiver signed. Others were able to use ours, trying to find the right person to go up this chain. And like Ernie said, once I really understood this process and the situation, like his chairman said, you just get it done to the best that you can. And I did the best that I could in terms of understanding the process and basically just getting the PPE in the hands of the docs on the front lines. So there are a lot of challenges. Also the time difference, you know, I'm talking to Mary at 6:30 in the morning because that's when I'm driving to work and I have time, and that's at 7 p.m. in Asia, coordinating on different groups, whether it's WeChat, which I never used before, and I was using WhatsApp and regular text, and literally having different text chains on different platforms. So many challenges, but I think we all worked together and we accomplished what we needed to do.
Great, thank you, Thomas. June, how about you in that last mile to the hospitals?
Well, I will tell you that, you know, obviously there's the logistics of you know, actually moving the boxes, and they're heavy. And I joke to people that, you know, that's my workout. My gym is closed and I stay in shape by moving the boxes. But, you know, I will tell you that, you know, in terms of the challenges, and I think Nick alluded to it, is that the authenticity of some of the masks and protective equipment that we're getting, you know, coming out from China. But we had absolutely every faith that, you know, CAA, you know, you were able to source the best stuff for us. And I will tell you that, you know, as we were trying to get all the supplies everywhere, there was a donor who stepped up and gave us 10,000 N95 masks, and that is to our hospital at Columbia. And I want to tell you, the hospital was so excited about it that they arranged for that to go immediately directly to their loading dock, and the procurement department just took control and took it out of our hands. And so they were very interested and appreciative of, you know, the PPEs we were giving. The hospital themselves institutionally took it. So that was very exciting.
Great, great. Last but not least, Rafen, let's have, hopefully,
Yeah.
Yes, great, here you are. Could you
Yeah,
share
okay, so-
one challenge that you came across? I know there were many, maybe the top challenge you had.
Yeah, okay, the most difficult thing is because of the US president constantly changing, then the China customs constantly changing the rules, and the US CDC also constantly changing the quality of their masks that could be delivered to US, so which gives us a lot of hard time to manage it. So we evolve our delivery from personal shipping, but now we cannot make any personal shipping like 2 or 3 weeks ago. So we have the large vendor that we could use to ship directly to the hospital. So, and we also be able to get on the one of the probably free shipper for some of the PPE because of the donation that we are currently working on. So yeah, that's, you know, we find out it's getting better and better, but still some challenges that we are facing on.
Great. What it sounds like is that in the face of challenges, you all found a way to get through it and solve it and use your network, and you were persistent. So I think it's wonderful that you were able to do that. We're very resourceful as Colombians, which is great. I do want to ask of the doctors, and this is also one of the questions from an attendee as well. Yes. Maybe one of the doctors, one or two of you, could talk to what you're seeing on the front lines in New York City in the hospitals.
I can speak in terms of, so I'm an anesthesiologist. We are experts of the airway management. So we intubate a lot of these patients since coronavirus is a respiratory disease. As the disease progresses, people require intubation. We're seeing improvements for sure. I think we peaked about maybe a week, 2 weeks ago. Up until then, I mean, it was chaos in terms of the number of admissions, in terms of the number of intubations, and in terms of the number of people requiring ventilators. We saw many deaths at our hospital. In the last 2 weeks, I would say the numbers have come down. My hospital, we had at our peak 199 cases of patients with positive coronavirus. Up to about 50 of them were intubated. We expanded our ICUs. We built basically brand new 2 units within several days to house the ventilated patients. One of those units we actually took down because we didn't need it anymore. Our cases now are about 120, down from 199. So, you know, things are improving slowly. There's still many who are sick. And at this point, you know, we need to be cautious as to not get a second wave and second peak. So that's what I've seen at my hospital. And I think that's similar at other institutions throughout New York.
I'm sorry, Ernest, I think you were trying to speak. If you can unmute, there you go.
Sorry, I'm gonna go try to share some. What, can you see this?
Yes, we can see your slides.
What, this slide? What's happening in Frontline? Do you see that?
What's happening on the front lines?
Okay.
Yes, we do.
And you know, before I forget, the most important thing is I got to thank so many people in this, in the audience, the donors, the people in Asia who've really rolled up their sleeves and really did a tremendous amount of effort from Hong Kong, Taiwan, Asia, Singapore, and please forgive me if we left anyone out. So these were the suits that were provided, these are hazmat suits. There really should be frontline people like Dr. Thomas Lowe in the ICU and the ER. You know, he really just is a quiet hero, because the anesthesiologists and the ENT people really took a hit. There were so many residents, nurses who were scared. They didn't know what to do, what kind of supplies, but PPE is a uniform thing that everyone must have. This is a snapshot of where I've been very fortunate to work the last 10 years. In the middle is an example of our ICU rooms. We have 400 of them. They're negative pressure. They have very nice views, but that's not the point. The point is that there's a lot of people in front lines taking care of these patients intubated. We get daily reports showing you curves, right? You know, we take social distancing very seriously. And these reports show you how the numbers slowly decline with time. We treated 6,500 patients in the emergency room. We've had over 1,000 get discharged from the hospital now, but we never like to see these numbers in red. This is an example of a patient that I'm taking care of now, who's Chinese dentist, whose brother died of COVID, mother who's 80-something years old is sick with COVID, son lives with the mom, and they are very frightened. And certainly these are the challenges that we are dealing with regularly. And we need cures. We need people to work hard developing vaccines and developing testing tools. Otherwise, it's going to be challenging for everyone else to move forward. These are some some photos. Upper left, you can see that's our OR. Our ORs were changed into some ICUs initially. So I'm a surgeon like June, and we had to stop everything. And I had the fortunate thing of being able to work as an intern, which I hadn't done in 20 years, gown up, work with the people front lines. And that was probably one of the most gratifying things I had a chance to do. And lastly, again, I want to thank everyone. March 3rd, I was taking a bus to see some friends and see a show, and you can see this sign, Hubei, 加油. That's, I was like, well, you know, that's great. We're reaching out to them. This was before everything happened. And again, this is from an IMPay building that's across from NYU. And it's to thank everyone in the audience, everyone who's worked so hard to make this thing happen. Thanks.
Great, thank you, Ernie. Okay, so Mary, I understand that you were involved in, as you said, managing the delivery of the PPE, and June, you were actually out there making the deliveries. June, you kind of alluded to it earlier, the reaction of the doctors and the healthcare professionals when they received the PPE. You said they were overjoyed. I think that, Mary, if you want to talk a little bit about what reactions you've come across. Please unmute yourself.
Okay, can you hear me?
Yes.
Okay, thanks. The morale amongst the medical community was very low back at the end of March. They didn't feel like they had the adequate PPE, and the number of people dying around them was skyrocketing. So when they actually received boxes of PPE in their homes, it was a real morale booster, and they sent me emails of gratitude, which I would like to share with you. So here is a photo sent to me by an alum doctor from NYPD Columbia who received PPE in her home. She gave us an update of the situation in New York City and then expressed a big thank you from New York City. Here we have a photo sent by an alum, Dr. Jacqueline Worth. She wrote that the PPE was a true lifesaver. And what I like to point out here is that she didn't feel that she needed the isolation suits. So she brought it to her colleague at Bronx Care Medical Center, and you see a photo of him here, and gave the PPE to them where she felt the isolation suits would be well used. So having the doctors distribute the PPE within their own network was the most direct way for us to get the PPE into the right hands. And of course, June, Tom, and Ernie were very helpful on this front as well. And we also sent PPE to NYPD and the fire department for them to distribute amongst themselves and within the local community.
Thank you, Mary. June, do you have any additional remarks about the response you got from healthcare professionals when you deliver the packages?
You know, as I said, they were so happy. They saw me and they're like, what are you doing here? You're a plastic surgeon. And I said, PPEs. And they're like, great, great, great. Put them over here. We definitely have use for them. And so then sort of for a couple of weeks there, you know, I would, because my car is only so big and I would have to make multiple trips. And so they would keep seeing me and then I would tell them I'm coming tomorrow. And then they would say, oh, I'm not here, but so-and-so's here. This is their contact. And so that you can, you know, drop things off, you know, because there was some parking illegally, you know, around to drop boxes off. So we had to do it very quickly. And I did not get any parking tickets. So that was the best part of it. But, you know, yeah, it was just, I was so happy to see my colleagues and my friends, these are people I work with and to see them sort of just to know that there are people thinking of them and they very much appreciate that, you know, that they're not alone out there.
That's wonderful. If I can make a comment on that also.
Yes, Thomas, go ahead.
Yeah, so I just want to reiterate what June was saying. You know, the morale at the hospitals when this all started was devastated, was very low. People were dying. Doctors were sad that their patients were dying, but also they were scared because they didn't have the proper PPE. When I physically dropped the boxes off to Columbia, to my old department of anesthesia, you could just tell from their expression, just their faces. They lit up. They were so happy. It was as though like you're going to war and you have reinforcements coming, or you have a drop shipment of ammo, because that's what we need. We're all doctors. We took a Hippocratic oath to help others, and we all are doing it, but we need the proper protection. And when we came and delivered these PPE, it was like the reinforcements were coming. And my old roommate from medical school, his name's Dr. Chris Reverte. He's actually an emergency room doc, not at Columbia, but at Mount Sinai on the west side. And he was telling me, you know, when he got his delivery in the mail, man, he called me up and he's like, wow, he was, you know, just so thankful. And his whole entire department, you know, was like the reinforcements came. And I got countless emails, random people calling me that I didn't even know who was calling. And I was kind of afraid to pick up because I get a lot of scam calls, but I picked up and they're like, and it was actually some of the people that I had spoke to. And when they received their deliveries, they gave me a call and said, thank you so much. And it was very meaningful. Thank you.
Thank you, Tom, for sharing that. So for all the attendees, I know we are at about 5 minutes before 11, but these stories are so rich and we may go over a little bit, but I do think that I think it's worthwhile to continue to hear all these individual stories and their great efforts. The next question I have is for all of the panelists. Reflecting upon your experience, which I can see you're doing now and you have been doing in preparing for this, what are the one big takeaway, if you could narrow it down to one and maybe at most two, you have your takeaway from this overall experience? If I could start with June, please.
Hi, yeah, oops, unmute myself. Sorry, I had to unmute myself. You know, it just, this is great. I mean, this is the reason why we have Alumni Network, and this is the reason, I mean, I feel like, you know, like Columbians band together, and you know, a lot of us have not met face to face, and there are people, you know, that I maybe only know by name. I don't even know what they look like, but we have this common bond, and that is Colombia, and we came through.
Great, thank you. Thomas, we'll go to you.
Yeah, so I agree with June. I think, you know, during times of crisis, during global pandemics, which this is my first, I think for everyone, you know, with the devastation, you also see a lot of great efforts, and this is one of so many different leaders, all from Colombia, banding together, working together. Like June said, you know, for example, Rayfin, I only met recently, just over, you know, WeChat talks, and you know, you really have to trust our leaders and our friends to put together this effort. And I think with such a devastating pandemic, a lot of good can come about.
Thank you. Ernest, I'll come to you. The key takeaway?
Yeah, I think the key takeaway for me is persistence, and if I'm very set on something, I don't take the answer no very well. I mean, that's probably a surgeon's kind of mentality. You can get these things done in a very tactful, meaningful way. I think this is one of the most wonderful initiatives that I've been very fortunate to be part of. Again, you know, this is an example of how Asian Colombians can unite and make a tremendously meaningful difference. Thanks.
Thank you, Ernest. And I'll come to you, Nina. Okay.
Yes. Yeah, I feel the great love, you know, we got from Colombia, and then we get back to Colombia. And also, you know, the education we got from Colombia, and we trust each other, and we really, you know, everyone has the very smart and have great experience and connections and energies on this, you know, very short time project to help the New York City and help the Colombia. And the other is the CAA. You know, we always, you know, heard, you know, we have 300,000 alumni all over the world, but this is the really a true project, and the first time I feel the power of the CAA.
Thank you. Thank you, Nina. I'm going to move over to Nick. Go ahead.
Yeah, so for me, so when I was on the CAA board, we constantly talk about engagement. And I think this is a perfect example of engagement. As Tom and Jim mentioned, the power of the network is incredible. And I think the willingness of everyone to basically put in their best effort is really amazing. I was really gratified by all the work that's been done, and also overwhelmed. Like I said, when I started with this, I felt really kind of depressed because of the situation in New York. My son is still in New York working. And so it was really gratifying to see everyone come together for this effort.
Wonderful. Okay, moving to Rayfin.
Yes, I'm here.
Okay, could you please share your key takeaway, please?
Yeah, I think for this time, alumni could unite together, help each other, even through WeChat, through Zoom, and you know, from all different locations. So, which could build us a foundation that we could do more others through the internet, message, audio, or video, regardless the difference time difference, the locations, the different schools, different countries, different CAAs, with no boundaries. So I'm looking forward to work with all of you more. Yeah, thank you.
Great. Thank you, Rayfin. And last but not least, Mary.
Thank you. Well, I've had a chance to work on many events with our Singapore alumni, but this is actually the first time that I've worked on a project of this immense scale in such a short time period with alumni across so many different geographies and time zones, as well as different schools, like Rayfin at C's and Tom, June, and Ernie from the med school and the business school, and Nina from SIPA, as well as students that are currently on campus and administration. And so with a few phone calls and emails, we were able to get connected right away to the right people within our Columbia community to get things done. And that was very helpful given the critical nature of getting our PPE to doctors as soon as possible. I'm truly proud to be a Columbian, and this project gave me the opportunity to work with so many passionate, driven, and caring alumni, as well as friends. And it showed me that although the virus is very contagious, the power of the human spirit is even more contagious, and that a lot can be accomplished even when you're stuck at home in quarantine. Thank you.
Mary, well said, well said. I think the takeaway after hearing all your stories for me is, again, reiterating a lot of what you're saying, the power of the Columbia Alumni Network, the strength of CAA in bringing us all together, and also the ability for all of you and all of us as individuals to inspire others to do more. Each of you had to inspire and convince the next person to get involved. And I think, you know, you all have done such amazing work in such a short amount of time. I just want to take this moment to applaud and thank you for all that you've done in the fight against COVID-19. And I hope it inspires others to carry on in their own way, to carry on the torch. So this leads to my last question. After hearing about all your wonderful work, there will be many people out there who are inspired and want to help, as is, you can see one of the questions, how can some other schools get involved and help? So why don't I ask that question of all of you? How can people help now in the fight against the pandemic? Nick, do you have some thoughts on that?
Yeah, so for us, we have come to the tail end of this effort, but obviously we're not out of the woods yet. And as you can see from today's panel, many of our alumni fighting on the front lines are Asian. And I hope that everyone will be inspired to contribute in your own way to support these heroes and also other people impacted by the pandemic. We actually I'm also on the ICA board, and from the communications team, we'll probably be sending out some information after today on some of with links from Columbia on how you may be able to help. For those who can't wait, it's covid19.columbia.edu. And if you go there, there are various options for you to kind of see how you can help, whether it's with your time or maybe if you can make a donation.
Great, thank you. Mary, you're involved with lots of different projects. Is there something you would like to share? Unmute yourself, please.
Hi. Okay, I'd like to share a slide. Donald Briggs, he was one of the alums who agreed to receive the PPE shipments from China when we were trying to get as many addresses as possible in New York City. He graduated with a Master in Fine Arts from Columbia, and unfortunately, he suddenly passed away from COVID-19 and never had a chance to see the PPE shipped out of his apartment. Now, Don's family, including his sister, who is a nurse in Florida, was very touched by our PPE effort. And as a tribute to Don, they asked us to set up a PPE fund under his name to continue his spirit of generosity. If you would like to donate to the PPE effort, you can find information that Nick and his team will send out via the ACAA email.
Thank you. Is there anybody else who would like to share ways people can get involved? Okay. Well, we have gone over the 11 o'clock mark. It's about 11:06. Don't think we have time for other questions, although we did answer a few from the attendees. We did ask, so one attendee asked, how do we help? Can undergraduates help? So we as ACA will be sending out more information. So let me take this time to say that on behalf of ACAA, I want to thank all our panelists for sharing their time and their stories with us today. For all the attendees, I hope our panelists have inspired you to share your stories with us at ACAA. Please share and connect with us through email, Facebook, LinkedIn, Instagram, #ColumbiaACAA. Please also look out for details, as Nick said, in upcoming emails and social media channels about our Asian Columbia Alumni United campaign and our efforts to support Columbia students affected by COVID-19. Are there any last comments or final comments, anybody on the panel? All right, since there are no other comments from our panelists, once again, thank you. And thank you all the attendees for joining us today. Stay safe and be well.